and this is Knowledge for Wellness. And this show is to better inform you, because the more information you have, the better decisions you can make. And knowledge is power. And today's topic is on neuromuscular therapy. And bringing us this great information is Kay Trone Bashford. She is a certified neuromuscular therapist, and she is the owner of Benessere Body in Balance on the Mississippi River across from downtown Minneapolis. Now, Kay has been a wellness consultant for 15 years, and she specializes in the Paul St. John Neuromuscular Therapy. And she taught at the St. John's Institute for 8 years, traveling across North America. Then she performed therapy on athletes like the Minnesota Vikings and was on the staff with the Chicago Bulls during the 1998-1999 season. Now she specializes in keeping weekend warriors and baby boomers pain-free. Welcome, Kay. I'm so delighted that you could come to Knowledge for Wellness.
Thank you so very much for inviting me, Tina. This is such a treat. I've been looking forward to it.
Great. Now, you are the owner of Benessere Body in Balance. But before we get into your specialty, I'd really like for you to tell our viewers how you got interested in this.
Oh, this work it changed my life so quickly. It goes back about 1994, and I was in some pretty horrific pain. It was a low time in my life. Both me and my husband were chronically ill. At that point, I was taking 16 Advil a day just to manage the headaches, the pain in my body. I'd had a couple of EKGs for possible heart attacks, chest pains, endoscopy for stomach ulcer, all sorts of chronic issues. But the worst were the ear infections. Now here I was at 35 years old with chronic ear infections. And I don't know if you've ever had an ear infection, but you get dizzy. And it was the balance thing that really threw me off. And
your equilibrium, yes.
It does.
Very much so, yes.
So for 2 years, the doctors didn't know why I was getting ear infections. And so they continued to keep me on antibiotics. So then my husband, at that time, had chronic fatigue syndrome for 5 years. So chronic fatigue syndrome, you've got complete exhaustion. You might be in bed for 20 hours a day, but you're insomniac and you're not sleeping, you're not rested. And the doctors had told him, if you get over it, you're going to get over it. You know, some people last 5 years, but you'll be fine. Well, 5 years kind of came and went, and his pain was still awful, his exhaustion. So his mom calls from Florida one day, and she says, oh, I found this great neuromuscular therapist that has gotten rid of my neuropathy in my feet. Now, I don't know, I know a few people with neuropathy now, and the burning was so bad in her feet, as soon as she would take her shoes off, they would just light up on fire. And so she'd have to put ice packs on her feet throughout the night. And the neurologist she saw gave her some Valium for it. Well, it didn't help with the burning. You just don't care that, that your feet are on fire. So this neuromuscular therapist got rid of the burning pain in her feet. And she said to Joanne, my mother-in-law, she can help Mark with his chronic fatigue syndrome. Well, I was kind of upset. You see, my background was in the accounting, business, IT field. I was not one of those warm, fuzzy people that would rub your feet to make them feel better. I wanted double-blind studies. I wanted the proof. I wanted the test, the blood test. So when a neuromuscular therapist says she can relieve the pain, I thought, okay, this really, I'm having a tough time believing this. Our medical doctor at the university, his wife had chronic fatigue syndrome. So if anybody knew anything, shouldn't he know how to help it? So Mark goes down to Florida a few months later, and his mother made 3 appointments, or his father made 3 appointments for him to see Denise, this therapist. I had told him, please don't waste any money on that new quack that your mom has found. I really was that convinced that there wasn't much that could be done. So when he gets off the plane, after being there for a week, and he's had 3 visits with Denise, he's standing up taller.
Oh.
He's 2 inches taller. And I'm like, oh my goodness sakes, what has happened? Well, she had worked on his stomach and on his chest, and Mark had, with the chronic fatigue, a rotoscoliosis. So that's not only where the spine is curved this way, but it also twists this way. So Mark had been shrinking.
Oh, sure.
At 42 years old, he'd been shrinking a lot. And so all of a sudden he get off the plane and he's taller. He's like standing up straight and shoulders back. And over the next few weeks, I watched him get better and better and better. And the light in his eyes came on that he might be able to feel better.
Oh, wow.
So he would poke me and he'd go, does that hurt? And I'm like, well, yes, it hurts. And does that, ouch. And he says, nothing should hurt when I put this much pressure on you. And I said, well, I don't believe that. I hurt all over.
Right.
And he said, we need to go to Florida. We need to go see Denise.
Now it's your turn.
Right.
Yes.
There were no St. John's neuromuscular therapists in Minnesota at that time. And I waited a few months, and Kimberly moved from Seattle as a certified neuromuscular therapist. So my very first appointment was with her.
Okay.
She set up shop in Wayzata, and I went out to meet her. And she took a look at me, read my history, did a postural assessment, and then she said, how's your jaw? And I thought, oh, here we go. She doesn't even know what she's doing. It's not my jaw that's bothering me, it's my ears. I've got permanent hearing loss because of these infections. And she kind of smiled. She's putting on the rubber gloves or the latex gloves, and she asks me to open my mouth, and she massages a muscle deep in the back of my mouth on the roof, and the firing pain into my ear, it was just incredible. In like 5 minutes that she worked in those little muscles, that was my last ear infection. They were gone. And now I know that what I have is a rare condition. It's called a postulous eustachian tube. It's always stuck open. And when it's open, the bacteria from the sinus keeps reinfecting the ears. And what happened is I was talking to Kimberly, why in the world this would happen, because here again, I'm the analytical person. I want to know structure, form, cause, and effect.
Yeah, and the scientific proof, definitely.
Absolutely. So she explained to me that as that muscle spasms, that would have forced the eustachian tube open and allowed the infection. Well, all of a sudden I went back to that summer, my first ear infection, and I'd been playing with jaw breakers that were called tear jerkers with my nieces, and you'd put them in your mouth and everything was so sour that you would just pucker up. I'd done this to myself. I'd created my own ear infections from eating these sour jaw breakers. So how...
Something so innocent, yes.
It seemed, right.
Yeah. Wow.
So a few visits with Kimberly, and Mark convinced me, he said, let's go to Florida. Let's go and visit Denise. She's much more aggressive. She's been doing this for 10 years. So we went to Florida, and in the 6 hours that Denise worked with me, and she helped me work with Mark, stretching him out, showing how to strengthen the muscles in the back, keeping him open, she got me out of pain on a level that I hadn't been out of pain like this for decades. And gave me my life, I tell people, on a silver platter. The next year I wasn't taking Advil. I did some detox for my poor liver and kidneys of 16 Advil a day for a couple of years. And I lost over 80 pounds.
80 pounds?
80 pounds in that next year just from starting to feel better and to have my system working better. It was such a transformation. That was the tipping point. It's like, I can do this. I found that I loved anatomy. Physiology made sense, being that analytical accountant that likes things in checks and balances.
Yes. Wow.
Yes.
And she actually taught you how to help your husband as well.
She did.
Yeah.
So I started taking classes shortly after that. I eventually had to quit my other job as an accountant and business manager in order to do this full time.
Yes. Wow.
Yes.
So you had a bit of training then, and that was
about
through
a year and a half of training through Paul St. John's Institute out of Tampa, Florida.
Okay.
And as soon as I finished my certification, I knew that I loved the teaching part of it.
Okay.
So then I signed up to be a facilitator, a teaching assistant. Eventually, I was an instructor. I did a lot of training with Paul St. John and traveled all across North America to teach other chiropractors and osteopathic doctors, massage therapists, physical therapists, how to do this work. Because it's so different. It's not like any other body work modality that's out there. It's very unique.
Yeah, it sounds like it. But I do want to clarify the name St. John, because it is Paul St. John. So we want to get that out so it's not confusing to some of our Minnesotans here about St. John's Hospital or
the college,
yes,
right?
Exactly.
Yes.
So go ahead and explain that.
Okay,
as well.
and Paul St. John had developed this work based on his own pain issues, probably about 25 years ago. And he had broken his back in high school football, was in Vietnam and was shot down in a helicopter and broke his tailbone. He was then broadsided by a drunk driver when he got back to the United States. And his pain was so debilitating. And he started to investigate other ways that he could get out of pain. And through his studies and research, developed this technique. So he has now moved away from the term neuromuscular into integrative neurosomatic therapy. So it's a very integrative approach of looking at the posture, looking at the whole body on a very different level. Yes.
So I'm not sure a lot of my viewers know what neuromuscular techniques are. So if you could explain that in itself, that would be great. Yes.
Well, neuromuscular therapy or the neurosomatic work is a very different way of looking at the body. We're going to do a complete postural assessment, actually starting from your feet, working up. If the foundation isn't aligned properly, if your arches are a bit flat or rolled, it's going to affect your ankles, your knees, and your hips. People will come in with knee pain, and you look at their arches and their feet, and they're totally flat. Of course, with every step you take, it's going to affect the entire structure. So we're going to look at every part of the body, any rotation or tilt or any trauma that we have. And that's what sets this work apart over any other modality, I should say, because we're going to look at what's the cause. Now, you might come in telling me that you've got some neck pain, and if I find out that you're sitting at a desk all day on the computer and your shoulders are kind of rolled forward and your head kind of goes forward like this, the pain I would anticipate would be back here. But it's actually these muscles here and here that are pulling your structure out of alignment, pulling your shoulders forward. So neuromuscular therapy looks at releasing these muscles first. We have to eliminate the muscle spasms. We have to then restore the flexibility of the joints, the shoulders, the neck. Then we have to get proper biomechanics. So we need to get your body moving properly again. Then we need to strengthen the back and get increased muscle endurance. Now, if we do any of those things out of sequence, like say you decide you need to strengthen your back. You go to the gym because your back hurts, so you start strengthening that. Well, if we haven't alleviated those spasms, you're going to cement the postural dysfunction that's going on. So it's a way of looking at treating the cause of the pain, not just where the pain is. And that's what Paul St. John helped us to do, is to chart and analyze, and then the treatment protocols.
Wow.
It's very effective.
Now, you mentioned people that are, working on the computer and thrusting forward to, probably look at that computer screen.
Yes.
So who else would benefit from this line of work, or this technique, I should ask?
I work on people of all different ages, and from, as you said, professional athletes, Minnesota Vikings, Twins, Chicago Bulls, but lots of weekend warriors. So if you're training for your first triathlon, or if you've run many marathons, this work is actually going to help you to stay in shape better. Your recovery is going to be quicker. It's going to enhance the lifespan of your athletic abilities.